Health so much is about the level of trust that a community has with either the physician, the institution.
Say that again.
And it's no different from our ability to have trust in government. You have a community that may have experienced neglect or decades of neglect. The work to be able to gain that trust is much larger and much more needed.
My name is Tiffany Whitlow, and this is Now Included Unfiltered. Thank you so much for joining me today, Dr. Garth. Welcome. This is Now Included Unfiltered, where we're able to just keep it real, relax, but then share what is actually happening. How can we help our communities move forward and truly take control of their health? So thank you so much for being here today.
Thank you, Tiffany. Thanks for having me.
I am so excited to dive in. I know that you are a man with many hats. So tell us a little bit about who you are outside of the ER, outside of the hospital system. Break it down. Who is Garth? What do we need to know?
No, thank you. So I am a lifelong Chicagoan. I've grown up here my whole life over on the south side of Chicago, and frankly have been involved in healthcare over the past 15, 20 years, just trying to understand what's going on, why people are sick, why do some people get care, why do some people don't. And I think a lot of that inspiration started from a very early interest in civic engagement, but in terms of how I pursued medicine and how I ended up in medicine. Uh, Frankly, just had the benefit of having a lot of exposure growing up. But early on, I was more so into athletics. I thought I was going to be a football player, as you mentioned earlier before we were talking. I thought I was going to be competing with different athletes, but I learned pretty early that that wasn't my path.
So you didn't want to drop any names so we can put that age with you. You know, if you start dropping names, be like, oh, he played around those people's times, oh, that person's time. So tell us, you have two children.
Yeah, two boys. Lennox Maya Walker, Langston Mahai Walker. They are our world, me and my wife's world, and we've evolved our lives around them, and luckily been able to pursue our careers simultaneously as well. And they have just been a huge inspiration for us.
Wow, I love that. I love that. So, how is it raising children in Chicago, knowing that in cities like Chicago, your zip code can truly impact your life expectancy? I mean, by like 30 years.
Yeah, that's a great question, and I think that that line gets thrown out often, all the time. But I think what tends to be behind all of that is the social and economic barriers that make it difficult for different populations to get good health. You know, my children, they come from a two-parent household, both highly educated. Have food on the table. They go to great schools. Uh, that stat doesn't necessarily speak to what we're talking about here. I think what we're talking about is different zip codes that have uh, dealt with generations and generations of poverty, whether you think about the policy that's been inflicted on those communities and those communities that have never really had any true investment. And when you look at the schools, you look at the jobs, and you look at the access to healthy foods around those communities, you start to see very clearly why the life expectancy gap exists and how that manifests in terms of Black and Brown communities.
Yeah, I mean, and I think this is kind of where the intersection is between your mission there at Rush Health and what you all are working to do in our mission to empower 1 million people to take actions towards better health. Because that better health action could be drinking more water for someone. It could be going to the gym for the first time. It could be saying, hey, I'm going to invest in a Whoop, or I'm going to invest in something that's going to help me, measure my health, and I'm going to have control of that on my own. I'm not going to wait until I get sick and go to the emergency room, because a lot of people don't even have primary care physicians anymore. And so, what are you doing at Rush to really get into the communities and make sure that people are not only empowered, but then have access to better health care or to be able to empower themselves and their family members to take these actions?
No, that's a great question. And I think it poses a phenomenal challenge to how we think about institutions in general. When we think about healthcare institutions, anchor institutions, what we refer to them, they tend to be huge drivers of providing jobs, huge drivers in terms of community benefit and partnerships within the community, huge drivers in terms of research and exploring what are some of the benefits from those research and how we deliver those benefits to the community. At Rush, we challenge all of those pillars in terms of thinking about what our larger mission is in terms of impacting not just globally, nationally, but just as important, the local community. And we've had several examples in terms of partnering with laundry centers to create jobs on the west side of Chicago, ensuring that there's health benefits associated with that. We've taken innovation from Silicon Valley and partnered with a lot of our research here at our institution to be able to develop mobile apps that help to improve blood pressure and take up the activities that you just mentioned in terms of drinking water and exercising and picking up some daily habits. But also, we have a health equity institute that challenges and puts out a lot of research that, um, frankly, thinks about how do we see our systems in place right now? What are we doing to be able to create healthier communities? And what can our local community, what can the policy infrastructure do to be able to improve the health and lives of Black and Brown communities?
No, I love that. I mean, you really touched on something, and I do believe it is about the daily habits, right? I mean, even for myself, after having my son struggling through postpartum depression, it really, like, I could look in the mirror and I could say, okay, you're not yourself. You're physically not yourself. You need to do these things. It wasn't really until Christmas time when I found an outlet of going to the gym and working out with my college age children that I was like, okay, this is going to become a daily habit. This is going to become a part of my life. But it wasn't until something clicked for me that it became a healthy habit. Even though I know, have access to all of the things, have health insurance, just wasn't actually doing that. So once you all get someone to take their blood pressure or take that first health action, how do you stay along that journey with them to ensure that they don't get off that train?
Yeah, that's such an important topic to bring up because when you look at all the pressures across life, it's so easy to put your health on the back burner because you have something that's driving you right in front of you on a day-to-day basis, your children, whether it's your family or whomever, for you to make this decision that seems very important while kind of putting your health on the back burner. And I think one of the ways that we get over that is being able to just share and talk to people that if you're not healthy, no one's healthy. You can't be there for all the people that rely on you. So it's most important that you are able to integrate these daily activities, walking, picking out healthy items, making sure you find 30 minutes of activity to make sure that you are healthy yourself and there to be able to provide the love and care for everybody that's so dependent on yourself or your husband or whomever that is keeping the family together and trying to make sure everybody has what they need. But I think what you're also speaking to is what are what is within our environment that is frankly blocking us? What are some of the issues in our communities that are increasing stress or making it difficult to get that apple or that pineapple or making it difficult to have that 20-minute walk after lunch or dinner? Raising those issues simultaneously for our communities is just as important in terms of making sure we identify some of the activities that we can do on our day-to-day basis.
So, I mean, you've seen a lot. I mean, you have a little bit of a comparison there also from what you did in Chicago versus over in DC. So let's kind of talk about, from that White House perspective, how are things different? How are things unique to Chicago, maybe from that Washington, D.C. era?
No, that's a great question. So before I went to DC, I served as our deputy director at the Illinois Department of Public Health. So at the height of COVID, I was leading our department, communicating on a regular basis across rural and urban communities. And I think one of the most interesting aspects about Illinois is that it is arguably a reflection of the United States. You have urban, you
Hmm.
have rural, you have scale. It's the fifth largest state in the nation. And the issues that you are hearing on a regular basis across the state truly does
Reflect.
position you to be a little bit more effective when you have to provide some advice at the White House. So I was selected as part of a program called the White House Fellowship, where they select 12 to 18 individuals across the nation to serve in the executive branch. And I had colleagues that worked with the vice president, colleagues that worked with the president, colleagues that worked with the secretary of Veteran Affairs. I worked with the Surgeon General. And throughout the year, we focused on several advisory reports: physician burnout, youth mental health, gun violence, and then a little bit misinformation. But when you think about all the issues that's happening in Chicago, you look at our healthcare system, our nurses, our primary care physicians, our healthcare workforce was burning out. When you look at the gun violence, that was definitely an issue that was core to Chicago and figuring out how to mitigate some of those issues. And then obviously COVID-19, which impacted everybody nationally and really raised the discussion in terms of health equity in different communities. Because what it really did was challenge people to think about, why are certain communities so disadvantaged and the first to be affected at a disproportionate rate when we have a pandemic like COVID-19? And the reality is when you look at the social determinants of health of those communities, when you look at the policies related to those communities, access to wealth, access to income, it starts to make a very clear picture in terms of uh, why certain communities were neglected and why we're having such high mortalities occurring in different communities. And at the White House, it was an opportunity to be able to centralize those focus and really figure out how to be able to offset that in the future. We still have a very, very long way to go, clearly, given up where we are currently at. And there still needs to be a much deeper, deeper investment in public health to be able to speak to the humanity of those communities. But it was an opportunity to be able to serve in that capacity.
No, and well, number one, thank you for serving in that capacity. Thank you for bringing that expertise to the White House, because I do believe it is needed. You know, I think we have come far, but it does feel like overall there's an even larger gap, right? And it feels like, I mean, even like with AI, right? We internally we say like we have super users. It feels like there's people who are like super users of the technology and advancements. There are people who are utilizing biohacking and like really leaning in and saying like, I want to live the longest life possible, the healthiest life possible. And then there are these people that are like, I'm just trying to make it to tomorrow. I don't even have the $25 for the gym membership in my
Yeah.
monthly budget to even afford that. And like, it costs more money to go to Kava and eat out or go get a green salad than it does to go eat at McDonald's.
Yeah.
So knowing that there are people who are inner city with limited resources and limited income, how are you able to help them or advise them on what kind of questions they should be asking their doctors when they're thinking about this overlap and how to actually have better health with these other limitations?
Oh, so that's a great question. Health so much is about the level of trust that a community has with either the physician, the institution.
Say that again.
And it's no different from our ability to have trust in government. And that's why we see oftentimes the work that needs to be done for people to want to share their deepest and darkest health habits with somebody that
Honest.
that has their best interests. And so when I when I talk about Rush, one of the reasons why I joined was I need a strong mission that I can come to every day and that I can go to the zip code that's dealing with the lowest life expectancy gap and talk to them how we're thinking about supporting their community and trying to create more healthier communities. And oftentimes, when you have a community that may have experienced neglect or decades of neglect, the work to be able to gain that trust is much larger and much more needed. And we'll never be able to put a dent in any of these chronic disease issues if we can't get people to come and listen, as well as feel that the institution is there on their behalf. So that's why some of these other issues, such as hiring and community partnerships, are so important because people need to know that you care and they need to know that you want to see them live whole lives. So when by the time they come into our clinic, they're already there. They're already ready to be able to share, and they're already ready to be able to be a thought partner in how to improve their own communities. And I think that is one of the biggest misconceptions that people get about healthcare that is explicitly about the science. It is about the science, but it's also about the social science related to it. And I think that's the part that we're lifting and juxtaposing next to making sure people get their calf in time and making sure that they are getting their strokes or trauma treated in a timely fashion.
So, what are some of the things that you are doing in your everyday life to be healthier?
Oh man. So that's still a work in progress too. But the I
Okay.
would say that some of the most recent issues have been breakfast. I've really restructured my breakfast to keep it to eggs, fruit, water, coffee, and not necessarily add too many carbs. I just turned 40, so
Hey, happy
trying
birthday.
to trying to make sure that my blood pressure is controlled, and I'm on a medication that helps keep it under control. I exercise regularly, three to four times a week, and really just trying to be very disciplined in that fashion. If it's a tight week, I'll try to exercise or integrate it with my kids at the park and just run around and make sure I break a sweat. But it's really trying to be pragmatic, really trying to figure out ways to position yourself to be healthy. And to be clear, not everybody can structure their lives in this fashion. So I'm very aware of that. So I think it's about also leaning on your family members, figuring out can they help you on certain things? Can they help you get 30 minutes to go for a walk? Or can they help make some home cooked meals that are a little bit less salty or have a more of a healthy bend? So I think you really have to lean into your surroundings and your resources to be able to lead a healthier life.
Yeah, I see some influencers on social media and they're like, oh, my kids eat so healthy and so perfect. And I'm like, oh, yeah, I'm taking a lot of time for myself in the gym, but like my kid just had Chick-fil-A,
Yeah.
McDonald's. And conveniently is at that stage where he eats hot dogs and macaroni and cheese. So
Yeah.
there's that. But no, I mean, in all honesty, I'm thinking like, how can I really help my future generations by not having to have him unlearn unhealthy habits? Like he shouldn't have to like learn healthy habits. It's shame on me for not instilling healthy habits in his life. So I'm at that realization that I need to make adjustments no matter how much time it takes. And just tell him that he's going to enjoy that cheeseburger once a month instead of,
Well, I mean, but you raise a great point. One of the challenges is when people feel like they're setting a goal and it's too high and
yeah.
it's too hard to stick to, and all of a sudden you just give up. I think it starts looking at what's low hanging fruit, looking through your home, seeing if there's something you could eliminate. Just starting small and just adding these wins as you go throughout the month. over the year. And before you know it, they'll be eating healthy and running around, and uh, you won't even realize what you used to eat.
Yeah. So I was using the Cal AI app and I was taking pictures of all my food, no matter how bad it was, no matter how big it was. But what had happened was I came to Chicago and I went to Grimaldi's and I had that thin, buttery pizza. And I was like, at this point, I'm not going to take any pictures of my food in Chicago. And so I ate my way back to Alabama. So, yes, the struggle is real.
Yes, yes, yeah, yeah.
Real,
Well,
real.
but to your point, you got to treat yourself. So if you earned it and you figure and you put it on the day that you want to find and eat a slice of pizza, I think it's okay. But it's just once it
Did
becomes
you hear me say I ate the whole pizza?
okay,
I ate the whole
that's
pizza. It was a,
overindulgent.
it was a personal pan, but I mean, like it wasn't pan. It was a thin crust because I don't eat cheese, and it had no cheese on it. But still, it was so good. I was like,
Yeah.
so
Okay.
yes,
Then you might
yes.
need a referee there. This is where you might need a peer group.
This podcast is brought to you by Acclinate's Now Included community.
Get trusted resources backed by medical pros for your health. Tap into real experiences from people who look like you and find a safe place for your story. Walk into a space where being you is celebrated and find your power. Your health, your story, your power.
So, what is one healthy habit that you would like to challenge listeners or viewers to start today?
Well, one healthy habit I think that if you're in Alabama, you could do this, but just going for a walk after you eat. I think one of
In
the
Alabama, our listeners are all over.
well, I was speaking to you right there, but I think in terms of anybody, I think it's if you can have a chance when the weather's warm. I know it's not warm everywhere all year. Just go for a walk right after you eat. I think there's a lot of health benefits from your mental health in terms of controlling your blood sugar that can occur, and you can make it a family event. You can include your significant other, you can include your kids. I think after that is just trying to figure out what is one sweet or salty thing that you can eliminate out of your diet for the week and see how you do.
Yeah, I love those. Mine would probably be to practice the mindset because for me, once I started, I knew that I needed to have that champion mentality. And it was me versus me, but I wanted to win. When I first dipped my toe in, like, oh, I'm going to go to the gym, I'm going to work out, I got a whole membership. I don't believe I had that mindset. I didn't wake up every day and say, not only going to conquer this workout, but this workout's going to propel me and I'm going to use this energy to do something else with it, or I'm going to eat as if I'm fueling my body and gassing up. So for me, it was that mindset shift. So just practice whatever that looks like. To know me is to know that I like to think about pause, think about why you started, think about where we're going. Truly breathe and internalize your feelings and then go. So pause, breathe, and go are the 3 steps that I try to follow. But no, this has been amazing. Is there anything else that you would love to leave listeners or watchers with?
One of the things that I think it's important for people to take away is that being able to advocate for your health and include somebody to advocate with you for your health can be very powerful. Whether it's supporting a healthier school environment for your kids, whether it's supporting um, more parks within your neighborhood, just work with somebody, figure out what that gap is, and you can have exponential returns in terms of creating a healthier community and a healthier family members and the source that are able to engage in these new investments if you're able to centralize those issues for your community.
Awesome. Awesome. Thank you. So you're telling everyone to become an advocate, get involved. It's not just for you and your family, but it's also for the community. And the
Yeah.
community is who comes, is who shows up, is, we all get to create the community that we want to be a part of. So thank you so much for that advice. Thank you so much for taking time to be here with us today. I'm so excited to create a little bit, hopefully a little bit more exposure to you and to what's going on in Chicago and there at Rush Health. Maybe people will want to move to Chicago. Who knows? You never know.
It's the best city. It really
No,
is.
I don't know about that. All of our cities are the best city. No, thank you so much. This is Now Included Unfiltered. And don't worry, we saved you a seat. Thank you for listening to Now Included Unfiltered. If you enjoyed this episode, be sure to give us a follow and leave a 5-star review. We'll see you next week.